All right, welcome to the SoMeDocs Physician Discussion Panel following our Tuesday lecture series. This week we learned about writing for leadership, and I have a fantastic panel with me tonight, and let's learn and share wisdom together. Dr. Ne-Cheng Liang, tell us where you are and some of your experiences with writing.
Hi, thank you so much for having me. I'm Ne-Cheng Liang. I'm an adult pulmonologist practicing in San Diego, California. And in terms of writing, I am a amateur blogger slash article writer, but definitely enjoy writing. It's near and dear to my heart in terms of one of the favorite mediums for me to share my story. In terms of like frequent publications, I've published in Kevin MD a couple of times, the American Journal of Respiratory and Critical Care Medicine, and my own blog. And I've guest blogged on a lot of other physician entrepreneurs' sites as well. So I'm so happy to be here, and thanks for having me.
Excellent. We already have fans in the comments. They love your writing. Sending love. There we go. And for those of you who are watching and putting in comments, if you want to have your name seen, you have to give StreamYard permission. So go ahead and do that, and we can have some great interaction with our audience. Dr. Candace Good, where are you, and what is happening with you in writing?
Dr. Candace Good. I specialize in college mental health. I'm a psychiatrist in State College, Pennsylvania, in the middle of a snowstorm right now. I've been a mindfulness blogger for a few years, and in August published a book, Own Your Present, a psychiatrist's guide to mindful meditation and living a more conscious lifestyle. So since then, I've started doing some speaking on physician wellness, and I've also become a writing coach and a regular blogger for Psychology Today.
Excellent. And I know we talked about the SoMeDocs Writers Workshop coming up, and you'll be an integral part to that, is my understanding.
Yeah, I'm actually doing the authors' interviews. We're taping some of them right now. I'm talking to people who have written books, blogs, and op-eds. So a lot of the tips that the doctors are bringing up were also, some of them presented in Lisa Tenner's presentation last night. So it's nice to hear it from docs who have lived it. And I'm trying to keep up with Donna and all the ideas she has for all the other events that'll be part of the summit. So it'll be pretty cool, particularly since there's no Harvard Writers Conference this year.
Yes, it's a great opportunity to fill that void and engage physicians in a new way. Thank you. Dr. Vonda Wright, where are you and what's happening with you in writing?
Well, thank you so much for having me and letting me jump in. I am an orthopedic surgeon. I 2 years ago left the University of Pittsburgh, where I'd been for 15 years, and came to Atlanta to start a new department. But in terms of writing as an academic, you know, it's part of our job. So I've written on my research subject, which is musculoskeletal aging and living longer, as well as hip arthroscopy. But realizing that I could only reach a small number of people in my office every week, I decided to use writing as a vehicle for reaching larger crowds. So I've written 4 books for the general public, all about active aging, about how to optimize performance across the age span, as well as the obligatory textbook. But just using consumer-based books and blogging to communicate outside the office has been a really big part of my career.
Mm-hmm. That's a great point and a good segue into some of the points from yesterday. And we've heard here, all of us have had experience writing in both professional and medical journals and then for the public. Let's look at how we've changed that voice and how we might shift the way, style, tone of what we're writing when we move from place to place. Ne-Cheng, do you want to start there? You mentioned the different values and methods of publication. How do you shift between those depending on your audience?
I think from a mindfulness perspective, paying attention to your intention for your audience, because it's going to be different for where that article potentially is going to be published. So intention is of utmost importance for me in terms of shifting my voice from patient education versus a scientific article versus storytelling.
Mm-hmm. Mm-hmm. So helpful. And Candace, how about for you? Have you found that shift and any challenges to it perhaps as you move from different versions of your audience?
Well, I always view when I'm telling a story, particularly if it's a personal story, that's really my authentic voice. And so my book is sort of more memoir than self-help somewhere in there. So that the challenge is shifting that up for more professional blogging, particularly when you're trying to market yourself. You're very often trying to get into certain other blogs, and so you're adjusting to meet their style. And Psychology Today really doesn't want my opinion so much. They want like sort of a link to a fact, or the editor is very clear. I don't want I, which is hard for me to turn off.
Mm-hmm. Yes. And Vonda, how about for you? You mentioned such a wide array of styles of writing. How do you tune into the voice you want for each of those?
Well, I find that when I write for the public that it is and I actually say this in one of my books, I write as if you are sitting with me and we're having a conversation over coffee. So people will comment how conversational it is. But a good example of what the other speakers were talking about is shifting tone of voice is currently on my website. I am actively working to establish myself as a thought leader in the innovation space. So therefore, my blogs surrounding that are no longer conversational. They're conversational at an elevated level, meaning I'm back to talking to people who aren't medical, but using a lot of science words, which is not typically how I write for the general public, but there's a purpose behind that.
Mm-hmm. And have you found one of the recommendations yesterday, or maybe one of the gifts of this time, is the use of the hyperlink for resources? And so when you are putting a publication out, particularly online, that you have access to that, has that helped facilitate putting credibility into your writing, perhaps in a more streamlined way? Have you found that, Vonda?
Well, you know what? I think it's recommended, or it's always been recommended to me, that great blogs be sourced with these hyperlinks. And so typically my blogs will have 4 to 6 hyperlinks, not only to a reference, but to someone else whose community I want to connect to.
Mm-hmm. That's a great point.
Yeah.
Candace, have you utilized those in your writing?
Yeah, the links, I think you want them to flow naturally. One nice thing about links is then you don't have to totally explain the study as much as you would otherwise, because if people want more information, they can get it. But it also helps with search engines, I believe.
Yes, that's right. Mm-hmm.
That's a good point too. And I love that idea of the networking, right? So if you have one particular audience in front of you, being able to expand that reach by one click, that's really helpful. Ne-Cheng, have you put links to use to your advantage? Have you found them to be helpful for you? Or perhaps as a reader as well, do you find that they actually expand your engagement with articles?
Yeah, absolutely. If I want to bookmark it, but keep reading the article or the blog posts so that I don't like lose the train of thought or the focus, then that gives me kind of like a hold that thought type of action that I can take when I'm reading. From my own communications, I find that messaging to my audience is really helpful with the hyperlinks. It's convenient, and yet it doesn't necessarily have to detract from my message that I'm sending out to them.
Yeah, it offers that moment of intention for them, right? So if they would like more, it's available, but they can also just read the words as they are that you have provided. Welcome, Dr. Jeremy Toffle. We are talking about the use of hyperlinks in our articles. And let's take a moment and find out where you are and how writing is coming up for you at the moment.
Oh, it's going good. You know, every day is kind of different with it, and you have your things that you really like to talk about and write about, but then you there's some things that you really have to, you feel like you need to write for your audience too, and so those ones are a little bit harder to get up for, but it's working. So yeah.
Excellent. We're covering some of the key points from yesterday's lecture as well. We've looked at changing voice for different audiences, and I also like to look at now one that came up over and over again was setting that vision and kind of the goals for the writing, and that can go along with the voice, and finding out what has perhaps surprised you as a purpose that writing has helped you live into that you hadn't found in other mediums. And Jeremy, does that resonate with you? You like to start us off there?
Yeah, you know, I mean, for me, with trying to find the right voice that works, I think for me, but also for the expected audience was always kind of a juggling act, I felt like, because there's a lot of things I like to talk about, but not always everybody likes to hear about that. And so, in pediatrics, for me, it's with writing, my main target focus was supposed to be with dads. But you learn very quickly, dads don't like to read very much. And so your audience tends to shift a little bit there, which is fine, obviously. But then you kind of adapt it that way. So I think it definitely, finding that tone and that voice it's not always easy, but once you start to get with it, it flows a little bit smoother the more you do it. So I think, the more you write, the easier it gets, I guess you'd say.
Mm-hmm. And Vonda, you mentioned shifting to that communication with the general public. How did you decide, or did that decide itself for you, that was the way writing was going to be a most useful tool?
Well, so you other panelists are probably much more pure writers than me. I can write, obviously, but I write because it's a utility. I knew that if I wanted to reach the largest number of people, that I needed to be able to get onto the broader media platforms. The only way to do that is to write a book, right? Mm-hmm. So if I wanted to tell people that aging was not an inevitable decline from vitality to frailty, and here's how you do it, country that's dying of sedentary death, I had to write about it. So if you're I think your question was how does it interact with your purpose? And I'm feeling a little bit you guys are so pure in your motives. And my motive is I've just got to save this country from sedentary death. So I got to write some books because it's the only way I'm going to get out and be able to communicate it. But you know what? It's worked. Mm-hmm. It's worked. You are enabled to expand your audience, as Jeremy has found, from the dads to the moms and aunts and uncles. Everybody will listen once you write a book. So
yeah, I love that you, with all these books published, feel like that the intent is less aligned with you. It seems amazing to me. And I think that's such a great point, especially as we're here speaking to fellow physicians. So if writing, right, wasn't maybe your natural medium, but your message really was, right, and being able to reach a wide audience on this problem you saw day after day with your patients, how did you get over that, right? How did you say, even though I might not be a writer initially or organically, this is what I have to do, so I'm going to do it. How did you make that leap?
Well, here's the good thing about all of us is we have been in school so freaking long. Is that okay that I say that on this?
Oh, yeah.
We know how to write a research paper. So my approach to books and writing cogent tables of contents is not unlike writing a outline for a long research paper, right? The 8 things we're going to cover. And then each chapter in my approach to, it's not that my voice is so public that my books are not well researched. They are all backed up by papers, but then you have to translate into the common voice, right? So I'm getting to the point of every chapter is a research paper written as if you're telling the story to your Aunt Maud. That's how I get there.
That's a really great visual and prompt, I think. So everyone listening, take that note down and see if that helps you facilitate what might have been a hurdle in you getting to writing. Candace, how about for you? Did you find that vision, the goals, the purpose, did something really call to you that brought you forth into writing?
Well, for me, let me start by saying, I think that as doctors, we often sort of qualify our writing. Like, I'm an amateur, I'm not really a writer, just because we haven't done a million years of school. And we talk about imposter syndrome and everything. Everybody thinks it'll get better when your book's published and out. Yeah, it just gets worse because then you're marketing the book. But what I could say for me is just I had an incredible journey with yoga and meditation, and I wanted a way to explain it to my friends and family that I just couldn't do, and my patients that I couldn't do in 15 minutes or like just over lunch or something. But it was important for me to start stepping up and talking about my own mental health because I don't know, I think sometimes psychiatrists know how to handle every stressor or whatever. And, like I can fix COVID in a 30-minute check-in with one of my medical staff. So that was really important to me. So I told some stories that I was like, oh, I don't know about this stuff that I really held inside that I felt pretty defective, that I would be a psychiatrist and have all this training and still have all this like OCD stuff going on. Like once I started writing about it and it was sort of out there, it sort of went away. Like it's been really amazing that way. So you connect with people in ways you don't expect. And although I didn't necessarily write a book for my business, I wanted to use it as teaching in my wellness studio. It's really helped my business in ways I didn't expect, as far as networking and being able to talk on a podcast just to get your message out. So, eventually, who knows, maybe I'll make some money out of the thing, but it was an interesting process. And I think that I wish I had worked with a writing coach. And that's one of the reasons I decided to help people in that way, because it really, I live in the middle of Pennsylvania, in the middle of a snowstorm. We're all pretty isolated right now. So it's really helpful to have somebody to help with your confidence.
Yes. So fascinating, right? So even though there's that initial challenge of confidence, once it's there, it actually helps enrich it for you. That's so great to hear. Ne-Cheng, how were you called into writing? What purpose or what vision or what goal presented itself that really you found writing? You mentioned telling your story. Was that the main, or are there other things bringing you into writing?
Yeah, so when I was diagnosed with breast cancer back in 2011, I joined a writing group with cancer survivors that was facilitated by a cancer survivor slash writer, basically, like a published author. And we would write every week. And I found that it was a really cathartic way to express myself. And also artistically, the creative process was quite fun. So that's really when I found kind of my cancer survivor share my story voice. And then as the years passed, as I got farther and farther from my own acute treatment, and became more and more comfortable with sharing my story more broadly, I will say that the first real story that I told about myself was my cancer journey. So it's kind of come full circle. So yeah, that's kind of how I got into writing. Oh, and then I will say I had a very detailed blog about my cancer experience going back almost 9 years, and looking at it and laughing at the amount of detail that I wrote in the blog.
Mm-hmm. And we've heard here that thinking of the person to whom you were writing, right, and having a conversation with them, and that was brought up yesterday by Lisa as well, just that intimacy of that moment to help you communicate in a more focal way. Did you find, Ne-Cheng, that you were communicating to your fellow survivors? Were you speaking to yourself throughout that process? How did you navigate that? And did you feel like you had that person in mind as you were writing?
So during the writing workshop, it was really for me. It was writing therapy in a lot of respects. For the blog, as I was going through acute treatment, it was to update my friends and family. So the tone, even just between the two, even though the topic was very much the same, shifted. And the blog was much more factual, and then also a reflection of like my emotions, as opposed to more creative license that I was taking in the narrative writing workshops.
Yeah, I love that. Candace, for you, do you have a person in mind when you're writing, that conjures forth that more conversational nature?
Yeah, I'm writing to my 5 years ago self, before I really started taking care of myself in any way, before I slowed down, the mom who's too hard on herself. My book starts with me, a story about me forgetting my daughter at Barnes and Noble. Just forgot her. I mean, she was 15. I mean, it's not like a CYS issue, but, I worked so hard to get to her school on time to help out with an activity. And they walked up and they're like, "Where's Hannah?" And I realized I had dropped her off and forgot to go back for her. So I think people pretty immediately, but anyone who's a parent can sort of connect with that. Now, if you have little kids, you can't imagine leaving your kid somewhere, but it will happen.
Mm-hmm.
Yeah.
Absolutely. Vonda, you were mentioned directly, right? Thinking about having a cup of coffee with whomever it is you're writing for. As that person changes, how does that help you? Or do you always have this one? Do you have an avatar in mind all the time when you're in that writing space?
No, what's interesting that you asked me that question, because my previous books were for truly my patients and who come from all walks of life. But the current book I'm writing is really, I am the avatar, 40 to 60-year-old women, professional, modicum of success. And so my tone is changing. And I found over time, as it sounds like, Candace and Ne-Cheng found that the more personal stories you tell, the more people connect with you. So this current book it's called Behind the Mask, Stories from the Road to Success, but we're going to put a big imperfect, like somebody scribbles an imperfect, right? Because it's been successful, but imperfectly, right? So, but writing to me as the avatar is different than writing to my patients, because I am writing to professional people like you about what I've learned in the 20 years of my career. So it sounds different. It's a lot more details than the public would probably. They're not going to understand no work hour restrictions. I'm not still bitter about that, but maybe I am.
I love it. Yeah. And that we get to be in there and share stories, because sometimes we're prohibited, right? In a lot of technical medical writing, it's like, keep it, objective and not so much emotion. So to let that in can be really a gift, and also perhaps a challenge as we see if we can let that all come through. Jeremy, how about for you? You mentioned, writing to dads first and having to shift. How do you conjure up that person as you write?
Yeah, it's hard because it's really kind of based on, a lot of it has to first come down to what topic I really want to focus on, and then figure out what that audience is. When I'm focusing more on those parenting kind of dad aspects, I'm maybe focusing my voice a little bit there, and I throw a little bit of myself into with my blog, and so I'll talk about some of my woodworking projects. I tend to bounce around probably a little too much. It's probably why I haven't written a book and may not write a book for a while, because my thoughts just kind of go everywhere. But lately, obviously with 2020 and COVID and everything, I've been focusing a lot of, well, not a lot, but I've been talking a lot about the vaccines coming out and the safety profiles behind that too, just because I recognize that a lot of people don't still fully understand all the information for it. And there's a lot more information getting out there, which is great, but even some of my colleagues still had it. And so then I had to kind of shift my focus to how am I going to write for these people? So I feel like I'm bouncing my audiences around a lot. And so maybe I'm still trying to find my voice a little bit when it comes to a blog. But I know for me specifically, I'm definitely more of a conversationalist. And so when it comes down to trying to write something more for maybe the medical professionals and not just kind of the person next door, that's definitely more of a challenge for me, because that's not definitely, I know that's not my strengths. And luckily for me, I have a wife who's wonderful at grammar and wonderful at English, and she will only roll her eyes a couple of times when she reads my blog initially to correct me. So she helps a lot with that, which is nice.
That's a great segue too. And we did hear about some editing, and there are some, automated versions, Grammarly hiring an editor. And who might you bring in to read your first pass? And Ne-Cheng, I'm going to come to you. So share with us on this. And then I know we have to get you out of here as well to your next engagement. So perhaps tell us how you utilize editing, and then any closing remarks you have for writing, perhaps words of encouragement for the audience.
So in terms of editing, it really depends on where the final publication piece is going to be. Like for the patient education series documents that I wrote for the Blue Journal, that was a pretty stringent editorial process where I had like co-authors, so different iterations from the co-authors. And then there was a editorial board that goes over and in a lot of respects has to make appropriate the age level. Like we don't write higher than an 8th grade reading level for those patient education series. So for that, there's many more stages and it's a lot more time consuming. But like for a Kevin MD article, for my pieces that I've shared thus far, there's been some sort of igniting or compelling event that has inspired me to want to share my perspective or something that I've learned. And so for those pieces, I will read it again over once or twice to fix up the grammatical errors and punctuation and spelling, etc. But then just like hit submit. I think we can always go over things with a fine-tooth comb and keep editing and editing and editing. But one of my a physician coach once told me, and it's been a very helpful adage for me now, is done is better than perfect. And so for me, over the years and letting go of the myth of perfectionism and really being aware of this myth of perfectionism as a barrier to my own progress and my own growth has been really instrumental. In terms of like inspirations for writing, having the intention be first and foremost, like, why are you writing this, and why do you even want to write this, and why are you writing this, and having goals and objectives in mind so the piece can speak to a certain audience and potentially help that particular audience. But then also from a place where you can come across as authentic. And for me, authenticity and compassion are my main values. And so in a lot of my writings, I want to convey something compassionate or compellingly educational that the reader can take away, and as my like contribution to compassion. So yeah, I think that writing every day is helpful. When you feel inspired, don't wait too long. Just go at it and be curious, and it's not going to be perfect at first pass, but that's okay.
I think that's super helpful, and to know that there are ranges, right? So for editing and specificity and proficiency and precision, you can use different tools, and sometimes it's okay to read it over and submit it, right? And let that be how you begin. And authenticity and compassion sound like great guideposts for getting your word out there. Please let the audience know, and I'll put it in the chat as well, or in the comments, where to find you and your writing.
Do you want me to?
Ne-Cheng, I'll go ahead and put that in there, and then we'll.
Oh, do you want me to put it in now?
You can just tell me, if you can type it in yourself. Yeah, please put that in there so everyone can find you and your writing. And thank you so much for taking your time to join us.
Yeah, thanks for having me. Bye, everyone. Let me figure out how to put it in the comments.
Thank you. Candace, what can you share with the audience about editing? What's been helpful for you? And perhaps, do you find that there's sometimes you can have permission to just let it go, let it be, and submit?
Well, I think there's a difference between something smaller like an essay or submission versus when you're working on a book. The main thing I will speak to is the book. Since I did that more recently, don't show it to anybody until you've pretty much got your first draft done, because you'll start, I mean, I'm my own worst enemy, inner critic, type of thing. And if I had started getting feedback or started editing while I would have never finished my draft. I just wouldn't have finished it. Goodbye, Ne-Cheng. So that's one tip. And then there's like this coveted inner circle that you might show it to. The most important, professional editing is so helpful. It's also very expensive. So you want to clean things up as much as you can before you give it to somebody. Now, obviously, there are different types of editing. Developmental editing is if you really need help on fixing structure of the book or how best to bring out stories. That's you would want to do earlier on. I've used a couple of different programs. I've used Pro Writing Aid. I've used Grammarly just to clean up that. But that stuff they can really sort of take care of at the end through proofreading, copy editing, that kind of thing. But I think just getting the draft done is the way to go.
I think that's really helpful too, because we might be looking for that external validation, but it can derail us if we allow that to change the tone or the intention or the rhythm of the book.
Family, like your close friends and family, no.
And I see, Vonda, are you agreeing with that? Has that been what you found in the process as well? Oh, you're muted. Let me just make sure you're there. We go.
In all my books, I don't ask for opinions. I mean, I know what I know. I write it, and then when it goes, I haven't published myself, so then it goes. Now, it's not to say that I don't edit my own work, but I don't ask for a lot of opinions. And then when it goes there, believe me, they're going to edit it for you, and they're going to say, oh, we need to figure out how to tie these chapters together. But something Ne-Cheng said about done is better than perfect. One way to get it done, and it won't be perfect, but it'll be on the page, and then you can start editing, is we're all doctors. We are so used to dictating. Just dictate your brain and then those are easily transcribed online. There's all these programs, and then you can start editing your brain. Because otherwise, if you're a perfectionist like we all tend to be, you're going to edit every sentence as you write it, and you will never have anything on the page.
Mm-hmm. I love that. I was actually just saying this with a friend today, and we were having a conversation. I was like, I wish I had recorded this, right? Like, this was 2 chapters of information here. And absolutely, and I type pretty proficiently, but you do, when you see it, you're like, oh, is that the right word? And that's not the point, right? That's not getting the sentiment out. So I love that recommendation to just say it, right? And put it out there and then go back, because we can definitely get in our own way. Such helpful advice.
Yeah.
Jeremy, you mentioned your wife. Any other editing tools and resources you have found helpful?
I haven't really used many tools. I probably should, but I think one of the things for me is, like I said, I'm such a conversationalist that the more I edit down and change things and adjust words here and adjust words there, and I almost feel like I'm losing my voice. And like that part of me who's in that message is, when I write, it's meant to be coming from me, not from just kind of a generic person. So sometimes I worry that if I do it too much, that it loses who I am. So I definitely get, I'll just use examples. My wife is, she'll read through and she's like, I've told you like 5 times, you're not supposed to end the sentence with this type of word or do this. And I'm like, yeah, but I do it every day anyway. So that's me. And so those like things I usually don't change. But, I think again, for, as everybody was saying here, it's better to get it done than to be perfect. And I know for me, I can easily beat myself up over things and overanalyze and be like, that's not good enough, I can't do that. And so then it's just, I think for me, if I let myself overread it, then I go this route, then I go this person, then I go do this thing, it's almost too much for me. So I run a pass by her. I might run it by another colleague or another person, but really then it's just I submit and just kind of go from there. And there have been times I've gone back and read it after submitting, and I'm like, oh my gosh, how did I miss that? I gotta go addend that and change that there. So, but yeah.
Yeah, done is better than perfect. We're going to carry that through with us. Let's pivot a bit and look at how books can be, or writing pieces can be leveraged for us, right? And so, Vonda, you mentioned this was your platform to get your messaging out and connect with other audiences. We heard yesterday from Lisa to not give everything away in the book, right? So it's kind of the intro and it's the engagement, and then people can reach out to you, right? They might take a course, they might come to your practice. And how do you navigate that? Like, how much is enough to give? And what have you found have been the returns from your writing?
So, it has really helped me establish. So there's really 2 sides of my business or my career. There's the academic, the surgeon. I show up, I take care of patients. But then there's really this side we're talking about the writing. So writing books has enabled me to remember, I'm saying teaching is the most important thing to me. So it's enabled me to teach at a national level, because this is the only way to get on national TV, for instance, or to do a big book tour, or to get in front of people to change their lives. This is the only way. I've used books to sell products at Dick's Sporting Goods, right? If books don't make a lot of money, I hope people don't, unless you get a huge upfront from the publisher, or you're a famous politician or movie star. In my experience, even though my books sell well, I don't make a lot of money. But what I do is I leverage them to speak nationally, which pays me, to sell products somewhere, which pays me. You will be so surprised where patients will find you. And they're like, oh my goodness, I saw you online because you wrote a book. And then they'll come, and then that builds your clinical practice. So there's really no place that writing a book can't be leveraged. But remember, I'm writing mostly consumer books. So honestly, the other orthopods in my field, when I started this, thought I was a unicorn. Like, what are you doing? It's not about metal in a bone. That's right. It's not, but they're coming around.
And Candace, you shared a bit about that as well. Kind of an unintended but welcome consequence of your book was building what it sounded like your practice as well. How have you found that, and how have you seen that happen kind of spontaneously and intentionally for you?
Well, for example, right now, I think a fair number of physicians are becoming coaches and taking that approach. So this is sort of like, a book is like a ton of branded content, and you can have a course from that, or vice versa, have your coaching, turn it into a book. People want to buy what you got because they connect with you in some way. And so sharing a personal story, showing some vulnerability is really an amazing calling card that way. So.
Mm-hmm. And Jeremy, for you, have you found some surprising leverage from your writing?
I think for me, it's been a little bit of a slow burn, kind of on purpose when it comes to that. Having 2 little kids and full-time job and spending time with my wife, and where do you find time in the day, kind of thing. And so it's been kind of a slow process, which I've actually kind of enjoyed it because I haven't felt that need to rush into so much. But if you would have asked me a year ago if I'd write a blog, I would have said, no way. I mean, nobody cares. I don't like writing. English was not my thing. I didn't do that in college. And now I've actually just started up on getting a podcast together, and I'm hoping to get that started early next year in terms of releasing it. And so again, that's something I never would have done had I not started a blog. And so I think for me, it's still this journey of finding that voice and really trying to kind of finding what that message is going to be. And hopefully with that, I'm hoping for it to give me more opportunities down the road. Could it be speaking? Could it be writing a book? Could it be doing other aspects of that? I think it'd be, we'll see, I guess. So
Mm-hmm.
I'm still the baby of the group, I guess. I don't know.
We have to be at all stages, right? I think that's helpful for the audience to hear as well, that writing can happen in lots of different iterations. And we even heard yesterday, and we're in SoMeDocs, of course, that Twitter, is like the microblogging. So there's even that smaller version of getting your writing out there. What I'd like to hear is if writing, and all of you again in clinical practice and managing and how much time there is, has writing helped keep you engaged in medicine, right? Because you have an outlet, because you have an alternative, because you get to write perhaps about your experience. Has that helped you? Have you found that, Jeremy, that it makes clinical practice better, more enjoyable?
Yeah, definitely. I think, just focusing on so much of the mindset content, you guys talked about with coaching and physicians and some of that too. And I haven't gone through any coaching courses, but I've listened to quite a few podcasts on my drive to and from work. And, you pick up a lot of information that way. And obviously a lot of that can be used in the clinic. So, I'm a pediatrician, so there's always those questions, those concerns as how do we get through this, and utilizing those tools has been helpful. So yeah, I definitely think doing that has helped, again, with all the COVID vaccine stuff coming out. I never would have gone through and, read up probably on all the virology stuff that I have. I was not, studying virology really in depth a year ago either, but I've learned a ton on it. And I feel really proficient in that stuff too. And I can bring that to my patients and other people at work and that have questions about things. And I can be like, hey, look at this. And then they're like, oh, wow, you know a lot about this stuff. And I'm like, yeah, sure. Why not?
Mm-hmm. And what a brilliant way to blend it, right? So feeling like I'm not even a writer, I might do a blog, and I'm giving information on vaccines, and it's actually made me more clinically proficient with this, right? So these bonuses that come from it. Candace, what have you found? Have you found that impact on your practice from writing in a favorable way?
Well, I think for me, it's just created more balance in my life. So I'm actually, even though I think I'm working about as much, maybe more, like I'm just happier doing it. I think that people really recognize and appreciate, because I write about more ways other than pills to manage mood and anxiety and high functioning anxiety. And the fact that I've dealt with some of those things myself, people feel very comfortable coming in because they know I'm willing to talk about both sides of things. I also think that it's, didn't really bring it up before, but telling your story really is leadership and thought leadership, and it's mindful leadership, and being able to role model that for students beneath, students that I'm working with, that it's okay to talk about this stuff. It doesn't make you less of a doctor. In fact, all my quirky stuff I obsessed over for years is actually, what makes me uniquely qualified to do what I do.
Mm-hmm. Yeah, that's so helpful. And that normalizing and humanizing of our experience really is powerful for patients. And Vonda, how have you found it that you're not writing about, metal in the bone? Does that actually make those times when you're doing that more enjoyable because you're not spending all of your time in that space?
Well, because my public writing is informed by my actual academic research, it does it flows pretty seamlessly. It's just the way I present it. But you know what it actually does, interestingly? It creates attention, because I love speaking and teaching and all this side gig stuff. That would technically be considered side gig. I hope my boss is not listening. I love it as much as I do doing surgery. So it creates attention, actually, of, where I devote some time. But I think both are really important to me and to my patients. So.
Yeah, so I think sometimes having that variety of options for our identity helps actually strengthen it. And you get to see too, I really do love surgery, right? So loving writing doesn't mean you love surgery any less. It just means you love them both, right? It's like when we have a second kid, we just distribute it in a different way. I'd like to look at with writing and those next steps, right? So when you do have a book and you are invited to speak, or when you are that expert and they say, oh, I saw you wrote this article, will you come on our local television and talk about vaccines? Have you found, and you mentioned loving speaking, Vonda, and for the others here, has speaking come naturally? Have you worked to build that skill so you can talk about the written message that you've created? Jeremy, how about for you? Have you been in that space, perhaps being invited to speak in different ways, and how has that moved forward?
Yeah, I mean, I think I've always been a fan of public speaking. I've always enjoyed it. Back in school, if there was an opportunity in a group to be the person presenting, I typically was the one volunteering. And so I've always enjoyed it. So I wouldn't say it was something that I had to learn from that aspect. Now I tend to be a fast talker, so I've had to learn how to slow that down a little bit. But yeah, I think with some of the blogging and everything, and the fact that I work for Children's Hospital, and so it's not a private hospital; it's a hospital-run clinic. But with that comes a lot of exposure to local news, things like that. So I've gotten the opportunity, because I've shown that interest in being out there, to talk to them about different topics they want to talk about. So it's not so much always what's on my blog, but it's about, hey, we're running a story about, Halloween, and should people trick or treat this year? Would you come on and just talk about it? Yep, sure, great. And so I think that exposure's helped, and then that's given me that opportunity to get out there a little bit more. So.
Yes, and I think we hear this a lot. We might have great information and amazing offerings, but if we are in obscurity, we can't help people. So being willing to put yourself out there and find those platforms can be so useful. Candace, have you found that for you? How has it been for you pulling yourself into the speaking space, and what have those avenues been, and how have you felt about it?
I think IG Lives I had never done before until I was marketing my book. So I was very nervous at first, and I wanted the questions ahead of time, but it's better just to go on and be yourself. So if you do several of those and podcasts, it's all about just, even recording myself was really painful when I first started the whole thing. Now I'm totally over it. So just however many times it takes you to record yourself and sit there and watch it without flinching, just do it. It's worth the time. So the other challenge is, it depends on the type of media you're with. So I get interviewed by local news a lot, and they'll spend a half hour talking to me, and then the article or the news story will come on, and they quote the stupidest thing I said. I'll give them all this evidence-based stuff that sounds really good about, how child visits to the emergency room are up during COVID. And I got quoted on, treat yourself like a plant. That was my quote. So always ask if you're being recorded. They've used my voice, and I didn't know that I was being recorded sometimes. So Zoom land gets a little weird. Sometimes you think you're on Zoom because it's better to see someone when you're talking, but try and get that figured out, or ask ahead of time if it's going to be recorded on Zoom, because you'll think you're showing up for a podcast and I'm in my pajamas and there's the Zoom, so anyway.
Yeah, getting that clarity and knowing what we can and can't control, and whether you're willing to do that, right? If you need to have a little more say on what they utilize. And Vonda, you mentioned loving speaking. Tell us a little bit more about the platforms in those national arenas in which you have been a speaker.
Well, what I think what's important for us to remember are a couple things. We do not only have to speak in the arenas that you would think doctors would, right? So most of my speaking is for financial houses, right? Big life insurance companies, big other companies, because they want to know how to keep their people alive longer and active and healthier. So who are they going to bring? The orthopod that talks about that, right? In an entertaining way. Or women's charities that raise money for hospitals, right? You wouldn't think typically an orthopod would be the person. Or lately talking about how to be a CEO parent. And I'm thinking to myself, to the Chamber of Commerce here in Atlanta, I'm thinking, why are they asking me? So I made up a talk about being committed and energetic and optimistic in the time of COVID. So just remember that you as a doctor are viewed as an expert, and you in a variety of broad scope things. And you don't only have to speak to your narrow lane, whatever your specialty is. Yeah.
Yeah. Let's look at, we mentioned a few of these here just now, the social media platforms that you have found to complement or augment and amplify your writing. Candace, you mentioned the IG Lives coming up for you. Are there other platforms you've been utilizing that you have found to be helpful?
I find that my Facebook personal profile is actually better than my business page. I think just that's the way Facebook really likes personal social interaction. So it's hard. Like it can get frustrating. You post a blog and you spend a lot of time on it and you don't get much engagement. And that's pretty common right now, particularly around the election, because everybody's brain is full. And then I put a picture up of my dog and it gets like 100 likes or something, so you just have to stick with it. It's just, where's your avatar hanging out? So the publisher I work with, they're geared towards younger than me women. So they're on Instagram a lot. So I had to up my Instagram game a lot, although I'm still pretty bad with stories. I don't think I'll ever do an Instagram reel. But I know a lot of doctors are on Twitter, but like my Twitter game is really lame, but that's not where like the mindfulness people really hang out. It's hard to engage mindfulness people sometimes online because they're supposed to be offline,
Absolutely. And I think having this resource in SoMeDocs to be able to help nurture that and find out the ways you can utilize it. And there is the Instagram boot camp coming up. So you never know, there could still be an Instagram reel in your future. Jeremy, for you, have you found certain platforms to be most helpful for you?
I think I definitely piggyback on the private, not private, but the personal Facebook page. That's definitely where I think I get the most engagement when I do go to release a blog post. And I mean, I have a, if you want to call it a business Facebook page, but it's really just for the blog. And then I have a private Facebook group for dads. And you can imagine how little conversation there is in a private Facebook group filled with just dads. There's not a whole lot of interaction there. So I definitely say the Facebook personal page group definitely gets a lot more of my, the likes, the shares, the, hey, you should read this kind of stuff. I've dabbled with Instagram. I post things every now and then. Is it always related to my blog? No, it's probably sometimes related to, hey, look, my kids were sledding down the hill, or hey, look at this cool pasta dish I just made. I'm pretty proud of myself here. So that's probably maybe more of the personal side to me than anything else. But I could see that potentially changing over time and kind of adjusting and utilizing it a little bit more. I have a Twitter handle. I don't know if I've used it. So yeah.
And knowing too, right, that personal engagement matters, and making those connections can be building the audience for you along the way. Vonda, for you, have you found most success in any particular platform, or do you try to diversify that use?
You know what? I think each one has a really different audience. So I agree with Candace. It depends what I'm doing. I mean, Instagram is younger, Facebook is older. I can't keep up with the really, really good doctors on Twitter because they're just so smart. I don't tweet interesting enough stuff. But if anybody has the secret sauce, because I think that, like the rest of you, I put out some interesting blogs, but the most hits, Candace, literally my husband, my daughter, me cooking oatmeal. I mean, come on. Right?
I just sneak those links in, right? When you never know what to
my book. Right?
Yeah.
Yeah, and I was going to say, I know professionals were supposed to be really into LinkedIn, but anytime I post anything on LinkedIn, I get like 10 recruiters like contacting me in messages. It's like, I don't know.
Yeah, I do think, Jeremy, as a test, you should just see if you can communicate only like in memes or GIFs in your dad's group and see if that begins to build the dialogue.
It's actually funny, you know, when with the talk yesterday and how she was talking about putting QR codes in her book. I'm like, okay, I'm going to make a book, and each chapter is going to have an intro page, and then it's going to be all QR codes. It's going to be talking on video, and it's going to be perfect. This is going to work great.
That
Not
was
sure
a brilliant
how well that would sell, but who knows? We'll see.
I see graphic novel for you too, like bringing in the peds and the dads. You know, you just
there
have
we
to
go.
get outside
Find
the
something
box
out.
there.
It's funny, you know. I took a picture of my background set up for my podcast, and I was like, "Hey, look, this is so great!" And the whole wall is covered with maps, and they're maps from our trip to Italy from like 10 years ago. But one of the nurses in my office the next day was like, "Are you like trying to figure out a murder situation here, or like, are you doing like a murder podcast?" I'm like, "No, that's not how this is working." So I was like, "Well, we'll figure something out."
Good market feedback.
Yeah, right.
This has been so fantastic, and hearing about all of your experiences and encouragement for the physicians. I'd like to have a moment for you each to share what your writing is, your books, your blogs, and where people can find you, and also any closing remarks around writing. And Candace, will bring it back to you. If you're able to, you can type it into the comments, or if you say it, I will type it in there as you go.
Okay, well, I can type it while the others are talking, but
Excellent.
I can't talk and type at
simultaneously. That's totally fair.
Okay. My book is, if you just search Own Your Present on Amazon. As far as contacting me, my website blog is howtoshrink.com, just because Candace seems to be incredibly hard for people to spell. Originally, it was my weight loss running blog, but that didn't work out so good. So I switched it over to a mindfulness blog. And across most of like Instagram, I'm good enough doc. And you can certainly request me to friend me on my personal page, Candace Good.
That's fantastic. I like hearing about that pivot, right? So you tried something, it didn't quite take, and you moved and found what else did.
Well, you have to lose weight to shrink to fit in with the blog. So yeah.
There we go. And any closing remarks on writing for the audience, Candace?
Yeah, I think the main thing is just overcoming the perfectionism. Don't apologize. Just write. If you write, you're a writer.
Excellent. All right, Vonda, tell us the names of these books you've written and where we can find you.
I should pull them off the shelf and show you.
Do you have them there? Get
okay.
them. Yeah. Excellent. This has been so good.
I think they'll be backwards. So if you want to do a book club with people, this has been tested. Younger in 8 Weeks has written a Rodale book. It's been tested. It really does work. This is the first book I wrote. Remember, I don't like to write in general, but I wrote this to sell product exporting good and to communicate to people in the country that we cannot age the way. And then I decided that we needed a book about strategically planning health, because we plan everything in life but health. So this is a book, a strategic plan, 4 steps borrowed from business, and it has QR codes in it. So it actually does work. And then I was an academic, so this is the obligatory textbook based on my research. But so thank you for letting me show people that. That.
Thank you. And what's the best way to find you?
So in social media all over the place, I'm at Dr. Vonda Wright, and I put it up in the little chat, Dr. Vonda Wright, and it's the name of my webpage. And then I started a nonprofit called Women's Health Conversations, which also has a webpage and a podcast called Hot for Your Health. So it's all out there when you're driving in the car with nothing better to do.
Excellent. Thank you so much.
You're welcome.
All right, Jeremy, I saw yours and I copied it over into the comments. And so tell us anything more about writing and the best places to find you. Put it into the recording so people can hear it as well.
Yeah, so my blog site, it's probably the best place just to go to find me if you want to contact me or kind of see what I'm doing. It's www.imperfectdadmd.com, and imperfectdadmd is also my Instagram post too, or my tag, or whatever term you want to use for that. I think even if you don't feel like you can do it, you can. I think I would say I'm probably a prime example of that, because again, I never planned on writing. When I took my one required English course in college, I decided that was good, and I thought I was done with it. So, but it's fun. It helps in terms of all kinds of things, and it's not just getting out there. I think just for me too, it's just an outlet to use. And so I think if you've given it any thought at all, just try, just jump 2 feet in and just go for it. So.
Mm-hmm. I love that. The done is better than perfect is in the name of your blog. So you're embodying it there. Well, this has been fantastic. And for me, I'm at thisosteopathiclife.com and on Facebook and Instagram, and similar to all of you, in that same kind of depreciating use in that order. And my book is meant to be out at the end of this month. I'm in a self-publishing trajectory, but I think dictating is going to help me complete it. So Vonda, I thank you for that encouragement, because I've been hanging myself up looking at the screen. Yeah. And the Writers Workshop and Summit, Candace, if you want to share any details about that as we come to close.
Yeah, I think one of the bigger things is we're still looking for volunteers and people to get involved as far as organizing, and that could be leading a breakout group or helping getting people together for the book expo. There's going to be some live events, including like sharing ideas or pitches, and so you can contact SoMeDocs about that to get the sign up link, so we know how best to use all your excitement and skills. And there was a change in date. Initially, we were looking at like right around Valentine's Day, but there was another women's leadership event that same weekend. So we felt it was best, since at this point we were still working on presenters, to go ahead and move to later in the month. So it's a 3-day summit. It will be starting on the Thursday, Friday, Saturday of the last weekend in February, which I'm blanking, like 26th, 27th, somewhere in there, 28th.
Yeah, I think it was 25th, 27th yesterday. So I'll put that in there too. And let's all come together and write.
I was on call all weekend, so I'm still catching up.
Yes. Well, thank you all so much. This has been fantastic. And I look forward to continuing to see your words on the page. All right.
Thank you.